Abortion laws in New South Wales. Across Australia, the laws around abortion differ between states and territories. As I am a clinician in New South Wales, I will focus on the law here. It is estimated that the number of abortions performed in Australia each year is between 70,000 to 80,000, which means it's about 2% of pregnancies that are being aborted each year. In New South Wales, abortion is generally regarded as lawful if it's performed to prevent injury to the woman's mental or physical health, which includes economic and social factors. Under the Criminal Act 1900, termination is lawful if there's the procedure performed with consent and by a registered medical officer. The medical officer has honest belief based on reasonable grounds that the procedure is necessary to preserve the woman from serious danger of her life. And finally, if the intervention to terminate pregnancy is not out proportion to the danger intended to be avoided. There is a maximum penalty of 10 years imprisonment for woman or administrator of drug or noxious thing or instrument used to unlawfully procure a miscarriage, and up to 5 years to those who may supply the drug, noxious thing, or instrument intending a miscarriage. When and how are abortions performed in New South Wales? If the woman is less than 13 weeks gestation, then a thorough assessment of maternal physical and psychological condition is conducted. An accurate gestational age is determined. Any birth defects, a diagnosis probability and prognosis are assessed. Counselling is offered, and if the gestation is up to 9 weeks, then she will undergo a medical or medication abortion, which means that it's a combination medication that she'll have. So it's mifepristone, which is administered and blocks the hormone progesterone. You will remember from the Where Babies Come From lecture that this would result in the fetus not being sustained, and the pregnancy detaches from the uterine wall and the cervix softens and starts to open. The other medication that she would have is misoprostol, which is administered as it causes uterine contractions, so start squeezing the fetus out, as well as further softening to the cervix. If the woman is greater than 9 weeks, then a surgical abortion would be performed. From 13 to 20 weeks gestation, again, the same in-depth assessment of maternal physical and psychological condition would be conducted, an accurate gestational age is determined, and the birth defects, probability and prognosis are discussed and assessed. The woman needs to engage in counselling, and the decision for the termination is made after counselling and assessment has been completed. The medical officer may need to consult further with other relevant specialists as part of the assessment. For a surgical abortion, prices vary from clinic to clinic, but it can cost over $1,000 for the woman, and is usually performed, it can be performed under different anaesthetics. You can have local anaesthetic where the cervix is numbed, you can have twilight anaesthetic, or you can be full-blown, knocked out general anaesthetic. The entire process for the surgical abortion during the first trimester usually means the woman would be in the clinic from 4 to 5 hours, although the abortion itself only takes just a few minutes. So up to 14 weeks, the woman would undergo a vacuum curage, and this is where the contents of the uterus is removed under gentle suction after cervical dilation. After 14 weeks gestation, a dilation and evacuation is performed. Usually this is 16 to 17 weeks gestation, and this is where the contents of the uterus is removed using instruments, not suction. The cervix is dilated further than with the vacuum, and so there's a greater risk for cervical injury, and it actually requires 2 days of follow-up because there is that elevated risk of bleeding. If the woman is greater than 20 weeks gestation, in the assessment of need, the treating practitioner should seek appropriate consultation and advice as dictated by the individual clinical scenario. And there's actually a multidisciplinary approach, collaborative approach to this. If the termination is being performed up to 22 weeks gestation, then it can occur in New South Wales Health Facility. However, after 22 weeks, it is against healthcare policy in New South Wales and cannot be performed. Victoria is the only state that offers late-term abortions, so that's between 20 to 24 weeks, and they're performed in private clinics, usually by means of an early induction of labour, where the fetus isn't at a gestational age to sustain life, but labour is induced. Here are some references and resources that I used when putting together this presentation. Thank you everyone for listening.